and welcome everyone to the Indeed webinar launching the PCVE Monitoring and Evaluation Center of Excellence of the International Center for Counter-Terrorism. We're very excited to have you with us, and a warm welcome to everyone joining for today's webinar. My name is Kai Brand-Jacobson. I'm the president of the Romanian Peace Institute and the facilitator of the Indeed Knowledge Series. Today's webinar is part of the Indeed project, which is a multi-year project bringing together 19 partners from across the European Union from 15 countries, supported by the European Commission Horizon Line, with the aim of improving evidence-based evaluation, evidence-based policymaking, and evidence-based practice. For those who would like to learn more about the Indeed project, we have a QR code here on your screen, and you can also, from that, visit the Indeed website where you can learn about the smart hubs bringing together multi-sectoral, multi-agency practitioners across the EU, the toolkit, including the Indeed evidence-based evaluation tool, and a wide range of resources available for practitioners, policymakers, and researchers in the field. We're also very excited to share with you that today's webinar is part of the Indeed Knowledge Series, where we're producing a series of webinars addressing key issues in the PCVE and de-radicalization fields, focusing specifically on evaluation, looking at evidence-based evaluation, evidence-based policy, and evidence-based practice. In addition to our webinars, we're also producing a suite of video interviews with practitioners, experts, evaluators, and policymakers in the field, and we'll soon be launching the Indeed podcast, where we will be bringing out the video interviews also in podcast format to reach a wider audience. For today's webinar, I'm very glad to be able to welcome and to introduce Dr. Antoine Baudon, who is the business manager and deputy director of the International Center for Counter-Terrorism and part of the core team involved in the creation of the M&E Center of Excellence, together with Eileen van Leuven, who is the M&E officer and research fellow of the International Center for Counter-Terrorism. Antoine, Eileen, welcome. We're very glad to have you with us here today. As I mentioned, our focus of today's webinar is on this exciting new milestone in the field, the creation of the ICCT M&E Center of Excellence. Just to share with everyone our agenda and what we're going to be running through today, we're currently in the introduction and welcome part. Then we're going to look at really diving into this new center and what it's about with a session on advancing evidence-based evaluation and looking at why does M&E for PCVE matter and why has the M&E Center of Excellence been created. We're going to then introduce the M&E Center of Excellence, its vision, its purpose, what it brings to the field, and then be able to dive a little bit more into this topic of using evidence-based evaluation to support evidence-based policymaking and practice. This will be a presentation session followed then by part 3, exploring synergies between the M&E Center of Excellence and the Indeed project, the evaluation tool, and other products created from Indeed. We also will look at applications to the field, and here we will be inviting everyone, if you have questions, if there are issues you would like to get information from Eileen and Antoine on, we'll be opening up and welcome any questions, any input that you would like to share before, at the end of our webinar today, sharing with you some of the upcoming events in the Indeed Knowledge Series. So with that said, I'm very glad to hand over and to welcome once again Antoine and Eileen to today's webinar. And Antoine, Eileen, the floor, the screen, the microphone is yours.
Thank you, Kai. All right, perfect. I hope you can all see Eileen's screen. Can I get a thumbs up from you, Kai? You can
We see you well.
Perfect, wonderful, thank you. So thank you everyone for having us. Thank you, Kai, for inviting us, for coming. We're very excited to launch sort of unofficially again the Monitoring and Evaluation Center of Excellence. We have a small agenda of what we want to run through with you for the next 10 minutes. I mean, if you could go to the next slide, please. There we go. Sorry, it's a bit slow on my end. We want to give you first an overview of who we are at ICCT. In essence, why should you listen to us speak? Why ICT do M&E and why we're good friends in that sense also with Pature and the Indeed project. Why the center and what it brings to the field. So we will look at these 3 points. If you have any questions, please write them to the chat and then we can then get to them towards the end of the overall webinar. Aline, could you go to the next slide, please? Brilliant, thank you. So the ICCT is the International Center for Counter-Terrorism. We're think and do tank. Do in the sense, two senses. One, we don't want to write 5,000-page report. We want to have documents, product that are accessible and digestible in terms of language and size. Although if you do want a 5,000-page book, we have one just for information. But also do in the sense that we want our product to really be useful to the end user. It's not just what we think is important, but it's listening to the beneficiaries, to the donors, to the practitioners, to the policymakers of what's important in the field and why is it relevant. We focus on counterterrorism and PCV, so preventing and countering violent extremism. It also includes, to some extent, also more and more misinformation, disinformation. And we have 4 pillars of work. One is a pillar of PCV. One is a pillar of rule of law. That is, we believe we should follow the rule of law when doing PC and PCV. I think in this room, this is not something crazy to say, but in certain areas, we've seen that it is a bit contingent. We have a pillar of current and emerging threats, and we have a pillar of strategic communication. And across these 4 pillars, we have one, which is our M&E, because we actually do M&E of all our projects. We keep 5% of our budget for all our projects, whether the donor funds it or not. If they don't fund it, we take it from our own funding because we want to know, and this is the do part, did we have an impact? For every project, we have a theory of change, or program logic could also be called, and we want to know, we want to go from here to here, and at the end, have we gotten there? How well have we gotten there? Have people gotten sort of the knowledge they need, or have we shared the knowledge we need? And we're project-based in the sense that we don't have one big donor who funds us and we do what the donor wants. We apply to different projects based on what we think is important on the way we believe that it is. And we've worked actually with Patrier on applying for projects in that sense. So this is what the ICCT does. And all of this, as I said, is digestible. So if you go on our website, you will see that all of our projects are freely accessible. We've written 2 books this year, one on Russian influence on the far right, one on how to prosecute female returnees violent extremism from Syria, both for free on the website. If you want the book, you can buy the paper version, but the free version is on PDF. And we also publish an academic journal called Perspective on Terrorism, that and on the archives also completely free and accessible, because that is our idea that we want this knowledge to be out there and usable by everybody. Aileen, the floor is yours.
Yeah, so before we further get into the monitoring and evaluation work that we do and the M&E Center of Excellence, we thought it would be good to take a step back and talk about what we actually mean by monitoring and evaluation. So first, the monitoring part. Monitoring is often an ongoing process rather than a one-off exercise to track the progress of an intervention or an initiative, a project. And thereby it focuses mainly on activities and outputs rather than measuring the long-term impact, for instance. And because it's focused on activities and outputs, it is often done by internal staff who are also involved in the implementation. And the data can be used for project management purposes, but also for the different evaluations. So thinking about how that is then linked, the evaluation is the assessment of implementation or effects of at a specific point in time. And there are various types of evaluation. So it can be an impact evaluation, which you often hear about, but it can also be a process evaluation, an outcome evaluation, or a plan evaluation, which often happens in the beginning to test the design of a project. So there are many different types of evaluations, but they happen at a specific point in time. And what the Indeed project is really focusing on, and also what at ICCT we find really important, is that evaluations are evidence-based. And that means that the evaluations are integrated in different types of elements. So that can be external evidence, but also professional expertise and stakeholder values and preferences and circumstances. So it's really important to integrate different types of evidence in order to have evidence-based evaluations. So why did we become involved in M&E as ICCT? Antoine already mentioned it. ICCT have been doing M&E for quite some time, but sometimes it was more ad hoc or driven by donors. But 2 years ago, we started dedicating 5% of all of our project budgets to M&E. And we started really investing in creating our M&E expertise and an overarching institutional M&E framework. And in that process, we also created an introduction guide for the CT and PCVE field, in which we basically described the lessons from this process. So how we understand M&E, why it matters, and how to start as an organization. And basically I want to take you through the why. So why did we suddenly started integrating this so structurally within our organization? And there are three main reasons. The first one is that M&E improves effectiveness and impact. So as Antoine mentioned, we want to see what we do. We want to prove whether it has impact and if it was effective. And we also want to learn from that. So we want to be able to improve this for future projects, or when we're monitoring a project, we want to improve the project when we go through it. Then the second reason is that M&E is part of good management and public governance. So if you're managing a project, it's really important to first know at the beginning if the plan is sound. Is it a good design? And you can use evaluation for it, and then set up also the right monitoring structures. And then as you go through the project, you can adjust the project. You can see if the assumptions were correct when you go through the project. And all of that you can do with monitoring the project in a regular way. And obviously, also through the evaluations, you can see whether the project was managed well and how you can improve it for the next time. And then the final reason that M&E enhances transparency and accountability by showing what you have achieved and how you have done so, really increases the transparency not only to your own organization and to the stakeholders, but also to the donors. And if you make the results publicly available also to the wider public and the taxpayers. And that also results in accountability if people who made certain decisions are held accountable for the decisions that they made. And so those were the three main reasons of why ICCT wanted to do M&E, and why also we are wanting to create an M&E Center of Excellence to advance M&E within the broader CT and PCVE field. So I'll now hand it over to Antoine to talk a bit more about this.
Indeed. So, we've shown why ICCT does M&E, but what do we want to create an M&E Center of Excellence? And I think you go directly to the next slide, because we do our own M&E and we see a utility in it. We see good feedback from donors, but what we've seen in the field, both in terms of practitioners, the policymakers, and sometimes also the donors, is an underwhelming and underdeveloped use of evidence-based evaluation in the field of CT and PCV. In essence, that is, we know that there's certain challenges, risks of ineffective interventions. We have issues with sustainable impact in projects, and sometimes we see projects that are going on with no evaluation whatsoever. We've seen programs who this worked in the past, so we'll do it here without considering whether that application can go. And a lot of times, most programs really come from a really good place. They really want to do the right work. They're going in the right direction, but unfortunately, not necessarily tailored to the context or to any new changes, because they haven't done a proper evaluation from the beginning. The fundamental practice is not necessarily there. So what we want to do is we want to help programs to be able to get there. So we want the whole system to benefit from evidence-based evaluation without having to be scared of it, to say this, and to remove some of the barriers, the real or the imagined barriers. And we believe that by advancing the field and helping everybody do more evidence-based evaluations, we can have more impact, we can know what works, we can know what could work differently, how it could be done differently, and learn from it on and on and on, so that we really remove those barriers and we have more practice. So this is the whole point of the Center of Excellence is for us to help everybody move forward, get over those barriers. And to that extent, we've come up with 6 services that we are going to start offering as of today, which we're going to present to you in a minute, to help everybody get above those barriers, to bring in a pool experts to help out. So I'll give it back to Eileen to start presenting some of those services on how we can get that done.
Yes. So the services, they all feed into the core mission of the Center of Excellence, and that is to integrate M&E as a fundamental component in all CT and PCVE efforts. So yes, this is ambitious, but it is what we're striving towards. And by that, we want to leverage the M&E results to inform evidence-based policies and practices in the field, through also then connecting the diverse CT and PCVE stakeholders to foster positive evaluation cultures. So we really want the center to provide a space for growth and learning, rather than finger pointing and assigning blame. And we want to do that through 6 core services that we offer. And this is an overview of all of them. So then we're talking capacity building. So we have trainings, M&E mentoring. We also have an M&E help desk, but we also conduct external evaluations, support funders, and provide synthesis of evaluation evidence. We'll now go to each of these services in depth. So to start with the external evaluations, as Antoine already alluded to, we have an expert pool with leading M&E experts with a focus on the CT and PCVE field. And with these experts, we create evaluation teams that are able to conduct rigorous and evidence-based evaluations in all types of spaces. So it can be for preventive programs, it can be for counter-terrorism, it can be for law enforcement. We can use all the different types of methods. There are people from different regions with different geographical expertises and languages. So in that way, we can create inclusive evaluation teams. And those teams will be able to use mixed methods and participatory approaches to evaluation. And what I really want to highlight here is that the evaluation is supposed to be a safe space for learning and growth. So it is really not about pointing fingers at anyone. It is about learning and about growing the work that organizations are doing in this field with a lot of dedication. And the evaluation is meant to provide a space for learning and for reflection. And we also want then those reflections and learnings to be translated to practice. So how we can do that is, first of all, within the evaluation process itself, but also for other actors. So sometimes it's easy to get overwhelmed in all the different types of research and evaluation evidence that is out there. And we can provide digestible overviews of evaluation evidence for instance, teams who want to inform new initiatives or who want to stay up to date about the latest effective practices. So we can support with that as well. Important to mention here, though, is that obviously not all evaluations are public. So this would rely on the public information or the evaluations that we have access to from our own projects. So we don't have a magic tool with which we can extract all the evaluations from the companies, but from all the available evidence out there, we can do this. Then Antoine will go into the next.
Indeed, thank you, Eileen. One of the services you want to help is also to help funders and donors on how they can have M&E within their project, so to say, proposals, or more, if to say, their call for tenders, if I say, my apologies. So would be to come in so that the call already has a theory of change for a fund, so that they already know we want people to apply and have a theory of change that we decided to show us something, so that there is a base of M&E from the call and that it's embedded in the programs, but not sprinkled on at the end, but embedded within the program logic from the beginning. So if it's in the call, then it's going to be in the tenders, it's going to be in the project. So we want to get it from the root, I would say. We also want to help them to assess the proposals of they have an M&E theory of change, but are the frameworks proposed correct? Do they fit in? How do they fit in? maybe some of their teams need a bit of training, need of mentoring, and of course, then they need to evaluate the funds. So the idea is to really help the donors from the get-go say, in projects, you need to keep a certain fund for M&E. We expect it, and then they can probably say judge it or grade it in a certain way. Next one, please, Eileen. Thank you. And the other one is the M&E help desk. So this would be the idea that you could contact us and we would give you about 30 minutes of our time for a free consultation where Eileen or some of the experts that we have, depending on the skills required, or if there's also any linguistics or very regional context-based necessity, we could help out on answering some questions. It doesn't mean that behind we will want to sell you a service. That's not the point. The point is really that you can sit with us for 30 minutes. We can answer some questions. Sometimes you're stuck on a theory of change. Sometimes you're not sure what indicator to use, what methods. It's really to help, as we said, people pass those barriers, get on. But it could be for practitioners who need to write a theory of change. It could also be for donors who want to include M&E in a call for tender. So again, really opening the door so people can ask questions and we can see how we can assist in moving forward. Back to you, Eileen.
Sorry, I think I was muted. You should be able to hear me now. So then the final one is training. We are providing training to a range of different stakeholders involved in this field. So that can be policymakers, practitioners, funders, implementers, M&E professionals, everyone working in this field who would like to get more background on designing evidence-based CT and PCVE initiatives. So really focusing on theories of change, how to design log frames, indicators, doing the design right from the start. And also the other training on preparing, designing, executing, and utilizing evidence-based evaluations. So how can these evaluations be used properly and how can you integrate them and embed them throughout your initiative? And Antoine and I followed the Indeed training program and also the Train the Trainers. So we are also equipped to train participants on all the Indeed modules. So yeah, we're very happy with that collaboration and we're really excited to start implementing these trainings very soon. So that's a very good collaboration that we have there. And following up on that, we also provide M&E mentoring. So we can provide teams and organizations with expert guidance on M&E. So if there's a specific question or a specific task that, for instance, multiple M&E mentoring sessions would be helpful for, we can provide that. So this can either be following up on a training if there's a specific component that you want to implement, but it can also be in general on-the-job learning if that is what people prefer. It's much more hands-on and directly focused on the task at hand. And well, these were the 6 services that we are providing. And as mentioned, we're having many different ideas and different services that we would like to start collaborating on with others in the field. We're thinking about also synergies like with Indeed. So yeah, I would be very interested in discussing this further with you. Kai, I'll hand it over to you.
Thank you so much, Eileen. Thank you, Eileen and Antoine, both for that presentation and for all of the work that has been done by you and colleagues in creating the ICCT M&E Center of Excellence. We're now going to move to the next session of today's webinar, where we're looking at the new M&E Center of Excellence and linkages with Indeed. So what I'm going to do just for a moment is ask Eileen if you can close the sharing that you have there, and I will share with everyone my screen here, which I hope you can see now. And just to take everyone through some of the components of what has been created in the Indeed project and have an opportunity to hear together with and discuss with Antoine and Eileen how some of these tools are relevant for the work that they're doing at the Center of Excellence, and how initiatives like the Center of Excellence and the tools developed in the Indeed project can help advance the field. For everyone who would like to have the chance to engage with and to see these tools, they are all available on the Indeed website. We've shared the link in the chat. We'll also share it with you later in the post-webinar follow-up note, which will be sent out to everyone. On the website, you have the Indeed toolkit, and this takes you through the evaluation package, including the evaluation model, the evaluation tool, the e-guides. We'll also soon have an online e-learning course and much more. I mentioned the tool, the tool which has been created by colleagues from the University of Helsinki, working together with partners in the Indeed project as a whole, is a really hands-on practical tool created to support people working as evaluators, but also agencies, organizations, practitioners in the preventing and countering violent extremism and de-radicalization field, policymakers and others. And the tool takes you practically through 4 different possible approaches to evaluation, whether you're doing evaluation, formative evaluation at the start of an initiative, as Antoine was also saying, building evaluation, planning, and preparation into program design right from the beginning. There's also a unit that is for supporting evaluations when your programming or projects are already ongoing. There's a unit on outcome evaluation and evaluations at the end of completed projects, and also a wonderful unit on case evaluation and how to engage with specific cases and incidents to draw out learning from responses and initiatives and the approaches we're doing. And so that's what you see here, these 4 different modules that are available. To help you know how to engage with the modules, we also have the e-guidebooks, which have been created on evidence-based evaluation and how to design also PVE, CVE, and de-radicalization initiatives and evaluations according to the principles of evidence-based practice. Supporting that, our colleagues have also created a repository of studies on risk and protective factors. This work was led by Stefan Kloss and other partners. And in addition to the repository of studies on risk and protective factors, we're also now working on a repository of evidence-based initiatives. So these are some of the materials that have been brought forward from the project, which are available for the field. And Antoine and Eileen also mentioned the trainings that have been given. And in addition to the trainings provided directly by the project in Bremen and Madrid, there was also the follow-on training of trainers in Cluj-Napoca, Romania last month. And now participants from those trainings are preparing a series of cascade trainings, which will be taking place across Europe throughout the coming months. In addition to the cascade trainings in person, we'll also have a permanent self-paced e-learning course available online. So that was just to share for those joining for the first time, or for those who may not yet see that full suite of resources which have been created by the project to help present and to share those. Now, what we would love is just to dive in, Antoine and Eileen, in a conversation with both of you. So you've taken part in the trainings. You're also working in evaluation, and you've developed this M&E Center of Excellence. Can I ask you, what do you see as the relevance to your work going further, first, of the concept of evidence-based evaluation, and why is this important? Just to share with everyone, when we're speaking about evidence-based evaluation, we're speaking about an approach to evaluation which engages with the best existing knowledge in the field, what exists from within our organizations, what exists in the field. And this can be harvested from past evaluations. It can be harvested from the knowledge which can be gathered on the situation, on approaches developed within a field. In addition to best available knowledge, we're also looking at the practitioners' expertise and judgment, and a model which really engages with professionals and practitioners in the field. And the third component, the stakeholder and community preferences, needs, values, and context. So these 3 elements together. What is the relevance and the importance of bringing forward this model of evidence-based evaluation, which also, as you'll see in all of the Indeed tools, brings out this frame of JELSA and the importance of engaging with gender, ethical, legal, and societal aspects of PCVE and de-radicalization initiatives, and of evaluation in the field. So big question there, presented the tools, and now from your point of view as practitioners, which will be carrying forward work on evaluation in this field, how do you see the relevance of these tools and the importance of an evidence-based evaluation model in the field?
Yeah, that's well, thanks for the question, Kai. Yeah, so I'm working a lot on evaluations in the field, and I joined before all the Indeed products came out. And I would say that for me, even though I've been working on evaluation, I find a very helpful framework to think about evidence-based evaluations, because there are some toolkits for conducting evaluations or M&E for this PCVE field, but it's not focused as the Indeed tool on all the different forms of evidence that you can take into account and how to integrate that throughout all the phases of an evaluation process. And it also links it really to the design of initiatives. So the link between the design, the evidence-based design, and how you can then translate that to an evidence-based evaluation that then feeds again into an evidence-based design for future iterations. I find that very helpful, including then also the whole GELSEC component. I believe that is a topic that a lot of people recognize is important, but also quite hard to make concrete. And the Indeed project made really good steps in giving this a space and like a good place in all the different evaluation and design steps. So find a very relevant and helpful tool and product.
Brilliant. Thank you so much, Eileen. Antoine, please.
Great question. I would agree with Eileen, but I think I would add on also the utility of the whole package, that you've given everyone out there the tools to read it, to learn from themselves with the training of the online training, we'll do the cascade trainings and all the ones that were in the train of trainers. But in the end, it is a tool that is logical, that makes sense. It's not creating something new, completely crazy. It is innovative by taking what already exists and package it in a way that makes sense, that's you can follow. Maybe some people hearing JASA for the first time and like, what is this? It's scary. But when you read the document, it's very straightforward. Did you consider this? Did you consider that? And these are very important questions, important things you think of. And the whole package has been made this way. So when we started thinking of the M&E Center of Excellence, before going to the Indeed trainings and then the trainer of trainers, because Eileen went to Madrid, I went to Bremen, so we had 3 different experiences. We kind of came back and went, okay, we're gonna adapt a bit our approach to be much more utility. Sorry, I use that French word. I'm really sorry. To have much more utility, to be much more concrete. And this is what we want to do. This is how we want to get there. Because if we want more people to do evidence-based evaluation, if we want to remove those barriers, to either the visible, the invisible, this, can even say the stigma, the stereotypes that exist, if I can use these scary words, we ourselves as proponents of it need to come in with basic ideas, basic ways of doing it. And we think if you go baby steps, we will eventually get there. So this is how we see really the utility of it, that you can actually use it. And there's so many tools out there that exist that aren't necessarily very user-friendly. So that's also a big advantage.
Antoine, thank you so much. Really nice to hear that feedback and to hear that view from both of you as practitioners working this field, and as a concrete example of how a new pioneering initiative and Center of Excellence on M&E is engaging with and using these tools and results from the Indeed project practically. Thank you very much for sharing that. Now, we have a fantastic community of colleagues and practitioners coming together with us in the webinar from many different backgrounds and contexts, colleagues also who are working in evaluation, working as practitioners. Many have taken part in the Indeed trainings or others. And in a moment, we're going to open up together for a section on applications to the field. And this is where we'd like to ask you, as our participants coming together today, what do you see as applications to the field about the type of services that we've heard that the M&E Center of Excellence is offering? Do you see a value, and how can creating centers of excellence on monitoring and evaluation like this help in our work? We'd like to invite you, if you have questions for Eileen and Antoine, or views you'd like to share from your experience and work in PCVE and de-radicalization or in evaluation and field, please please do engage with the chat space. You can find it on most Zoom platforms, depending upon how you're joining us today. There's usually a suite of buttons either at the bottom or at the top. Sometimes there's a section where it says more, and if you click on those buttons, you'll see the chat section. So if you click on chat, you can bring forward your questions, bring forward comments that you would like to, and we'll engage in that discussion together on the applications to the field, which we'll turn to in just a moment. But before we do that, Antoine, Eileen, obviously the new M&E Center of Excellence is something that was a long time in the thinking through and the wanting to create something like this, the hard work going in also into designing what will it be, what will be the services that you will bring. What I would like to ask you is, what are your hopes now for the coming period? What would you like to see, for example, in the years ahead in the M&E Center of Excellence, in terms of the type of work that you hope to be taking on, how you'd like to see the center contributing to the field? What are your hopes and aspirations for the value that the center can bring to the field and the type of work you'd like to be engaged in with it going forward?
Yeah, I can share first my thoughts on this question. So what I think how the Center of Excellence can have most impact is, so we have all the different services, but I think how they can have most impact is if they can be basically used as a package by an institution, so that you can, for instance, have a training, then some M&E mentoring following on that, and then having support through an external evaluation, for instance, of the project that was designed or of the overall M&E framework that was done, coming out as an external and evaluating the whole program together with internal evaluators, for instance. So I believe that is how the center, how the services can be best used as like complementary elements. And then they could also have an impact in changing the cultures of organizations, because I think doing a one-off external evaluation is already a good start for the field. Not all or a lot of organizations are doing that structurally. But it is really about giving it an embedded structural place in many organizations and projects. And I think that by working and seeing the services of the M&E Center of Excellence as a package, that can be really helpful. So yeah, that would be my hope, is that organizations start working and seeing it all as a complementary offer, and also think about how to embed it structurally within the organization rather than doing one-time evaluation, for instance.
Thank you, Eileen. And Antoine, anything that you would add to that?
I'm kind of a dreamer, so I agree with Eileen, but I'm kind of a dreamer that I would, if you ask me what is the aspiration, well, the aspiration is that anytime there is any funds for PCV above a certain limit, that it must have a money component before it can go on. I think that would be the absolute dream. So when we see bids for Horizon from the European Union, or when the State Department come out with calls of 100, 200, $1 million, that said you must have an M&E component, and they can actually judge it as being sound. And by the way, the US is starting to do that. We're seeing more and more calls asking for 12, 15% budget on M&E. It's a great start. I think that would be the actual aspiration. Will we be the only impetus? No. And I think this is sort of the idea, is that we're starting an M&E Center of Excellence because ICT is known in the field. We're being known more and more. Patria is being known. There's more names out there, indeed. And we want to be part of the discussion, the voice saying we need more M&E. We don't actually see M&E as a competition. We don't think it should be. We should be more collaboration. Hence, where the Indeed program is a great start. Looking forward to the synergy discussion we're going to have afterwards. Really to say this is the aspiration, that it becomes within the culture of CT and PCV to have evaluation. We're in a field that is changing. I mean, 3 years ago, we had things that did not exist now, 5 years ago also. So the field is changing. It will change. So we need to be able to evaluate ourselves, not as finger pointing, as we said, but just to be honest. Are we doing what we want to do? Are we having the impact we want, so that we can have this culture of change? I think that is really the objective. And my speech is coming from a very different place than Eileen. We're different in organization. It's normal. And I think us coming together makes it then, I hope, something practical to actually get there in the short term. And then we'll see as time goes. For the end of the year, if we can have, after the Cascade training, another training, to be determined where in the world, we can train more people on the tool, on the excellence, and do external evaluation. These two this year, I would have a very happy 31st of January.
Thanks, Antoine. Good to hear. There are some great questions and insights that are being shared and coming forward in the chat, and we're going to turn to those in just a moment. And again, to invite everyone, if you'd like to ask questions of Eileen or Antoine, or if you have reflections you'd like to share, please do so and contribute to that conversation going on in the chat. Before we turn to those, though, two last ones I'd like to raise. You are working, you've created the M&E Center of Excellence to help support practitioners, agencies, those working in the field, bring forward evaluation in the field. But you're not only working for it, advising and training and working with others. Antoine, from what you said, you're also implementing it yourselves. You've made that commitment as an organization that you're going to dedicate 5% of your project funding to support M&E. And sometimes organizations and practitioners bring forward, how can we go about, how can we implement M&E in our work? This is one really concrete step that you're doing. I'd like to ask you to just talk to us about that a little bit and why making that decision is important. The second I'd like to ask connects with Eileen. You shared, and you both shared some publications you've done and some research. And could you share with us just in brief, because I know we could have a whole webinar and a whole presentation on that research. And we do have a brilliant video interview and podcast with Eileen specifically on those, which will be launching shortly from the Indeed platforms. But if you were to just extract a few key learnings from the research you did, which has helped to inform your thinking in creating the center and what you're trying to achieve or what needs you're trying to address, if you could share those with us. So first, talk to us a bit about this, making that choice and making a commitment to the 5%. And then Eileen, if we could ask you, just talk to us about some of these key insights that you drew out together with your colleagues from this research that is informing your work forward in the M&E Center of Excellence.
Thanks for highlighting the 5%. It's I'm not going to hide it. It's difficult. A lot of donors don't necessarily want it, so we have to take it from our overheads. So that is a bit difficult, but it's not the most difficult part, because the difficult part is actually when the donor doesn't want it, and I will not name any donors, but you create an M&E report for two reasons. A, you want to know yourself whether you've done what you wanted to achieve. Did you have an impact? You wanted to train prosecutors in Indonesia on how to prosecute on court national crimes and domestic crimes with terrorism. Have you done that? Are they trained? Do they understand? You ask a lot of questions, you have surveys. So then we know whether we've achieved what we wanted to achieve. And this is not a question of HR, then we keep the senior, we get, no, it's a question of, are we simply achieving what we achieve? But on the same tail end, we can then tell the donors, hey, listen, you gave us all this money. We can actually prove to you beyond just an output of doing a training, we've actually been able to have this impact. And then I'm sorry to say, we can say, please give us more money. So we can do more training, take it elsewhere, follow-ups, but also hoping, really hoping that the donor says, hey, they did M&E, it was 5%, it was useful, we're going to put it in there. The flip side is sometimes when the donors, we haven't had a donor who says, take out the M&E, said, yeah, that's fine, do it. But then what we're seeing is when we present the M&E in the end of project is, that doesn't need to go to the agenda, or they don't listen. You hear crickets when you have a Zoom, so we try more and more to be in person. And that's a bit difficult, that the donors don't necessarily want to hear it, but the more we do it, the more we put it out there. We're trying with Eileen to find a solution to have our M&E reports in an interactive way online, not 50-page reports. We have a way we're working the technical glitches, if I may say. And yes, glitch is a word for, we don't know what's wrong with it, I have to admit. But once we can solve that, we can have those M&E reports online to show people, hey, M&E can actually be cool, interesting, interactive, and with lots of graph rather than lots of words. So this is what we're trying to do with going on this 5%, and the M&E Center of Excellence, therefore, taking it to the other level. So stop.
Brilliant. Thank you, Antoine. Eileen.
Yeah, thanks so much. Yeah, I've indeed written 2 publications on M&E for CT and PCVE field. The first one was the introductory guide I talked about earlier. This was basically when I started this role as ICCT's M&E officer, I wanted to get a broad base of how, like, what the field is at in terms of M&E. And it really helped me, like, for me, it was really helpful to see there are a lot of different understandings of the field. Like, there are a lot of different toolkits, a lot of different guidelines, but for me, it really helped to at least get a summary introductory guide for myself. And then I thought it would be really helpful for others as well. So that one really informed me in my approach. And then I made it publicly available in case it was helpful for others as well. And then together with Amy Jane Giele, she's an evaluation expert in the Netherlands, we also created a guide. It's a policy brief. And well, when we were talking with donors, with others in the field about us doing M&E, we often received a lot of pushback, like it's not possible to measure prevention. It is too complicated to like get any good results. It is too sensitive. It's too time consuming. So we received a lot of, well, I would almost call it myths about like why you cannot do M&E in this field, and a lot of resistance. And what we did in the second piece is that we wanted to debunk all the prevailing assumptions that we've been confronted with when we talked about doing M&E for projects or evaluations in general for the PCVE field. And we started researching them. So first we wanted to look at, okay, what is exactly the idea people have about why it's so difficult to do M&E for this field, and why, for instance, they shouldn't invest in it, or it's a waste of money to do any M&E. So we researched the thought process people had. Then we looked at the challenges. So what is the underlying challenge? Because these ideas, they are based on real challenges. So what is the exact challenge that people have difficulty with when they look at the problem? So the real challenge is, for instance, like the causality problem is really difficult, like saying that intervention X really cost outcome B in a very complicated, complex situation. The causality, that is really challenging. But then we started looking at good practices. So we mapped out all the different challenges that the M&E field is faced with. And then we started collecting good practices of how can you overcome these types of challenges. And that's what we did in the second policy brief. And I really like that the examples that we have from the field. So some of the examples, they show that it's actually saving people time when they started engaging in regular monitoring and evaluation. So that directly debunks the assumption that it's too time consuming. It actually saves time. So we have then collected a lot of good practices that we shared with the field to overcome also the common ways of thinking about M&E and provide practical ways of addressing the challenges.
Eileen, thank you so much for sharing just those little glimpses from this very interesting and very relevant research. Antoine has also shared the links to them in the chat, and we'll be sending them out to everyone in the post-webinar note. If you haven't had the chance yet, highly recommended. Excellent thought pieces and research, very relevant for all of us working in the PCV and de-radicalization field and working to bring forward evaluation in the field. You mentioned this aspect about time. There's also the aspect raised in Antoine, what you were saying about cost, and it really is relevant to keep bringing forward to the field. When evaluation is done well, and it helps us to understand what works, what doesn't work, how and why. It isn't something that adds time, takes longer. It's something that, in fact, helps us to shorten time because it helps us to do work that actually achieves impact. Very often in the field, we're seeing programs, initiatives, policies in place which may not be effective in actually addressing the underlying root causes and drivers of radicalization and violent extremism. And sometimes we've also seen policies and practices in place that in fact worsen polarization or worsen the dynamics. So by implementing effective evaluation and evidence-based design of initiatives, we can increase the likelihood that the work we're doing actually achieves impact. And by doing that, we save time. Also, by improving evidence-based programming policies and initiatives, we are increasing the likelihood that we are saving money, because instead of spending billions over the years, as we have cumulatively in the field from 2001 until now, we'll often find much more cost-effective measures which can have increased and improved impact, and we'll be able to target our funding to the types of initiatives and policies that can actually work and contribute to the field. Thank you for that research. Thank you for raising those points. Now, let's turn to questions that we have. The first one that we've seen came forward from Abdirrahman Hassan Hersi. Abdirrahman, thank you so much for the question. What is the uniqueness of the M&E Center of Excellence compared to all the other M&E exercises out there conducted by national, regional, and international organizations?
I can answer that one, because actually I saw the one in the chat. It's a really good question. I think the uniqueness is not that we're trying to come in and say, this is how you should do something. It's us trying to do it the other way around. It's trying to get people to come to us and ask us, how can we do this? How can we tailor? Because that's sort of another question of, how can this be tailored? How can the toolkit of Indeed be tailored for Nigeria, for example? Or this is how we could help to sort of come and help with those questions. And if we don't have the knowledge, then we're sort of a hub, and we bring people in, the expert that we know, as I said, whether on the physical, on the context, on the linguistic, or on the subject matter, if it's very specific. So this, I think, is the uniqueness. Is not, we're not trying to get to people to use our method, but the other way around, and really trying to build a culture of change. And as I need press in one of the presented in one of the points, it's also a safe space. We don't want to point fingers. We don't say, oh, you did such a bad evaluation, you suck. No, we want to say, okay, this is what you've gone. How can we go move forward? How can we better? But as a capacity building, going together, as the saying goes, if you want to go fast, go alone. If you want to go well, go with somebody else.
Thank you. Thanks for that response, Antoine. We have another question brought forward, or input and reflection from the brilliant Sophie Ebeke, who also we've done. Sophie is with a very exciting initiative, Preval, in Germany, which is a national initiative bringing together many actors in the field in Germany, looking at improving evaluative practice and using evaluation there. We also have a video interview in the Indeed Knowledge series with Sophie. We're hoping to be able to do a very interesting future webinar looking at developing and implementing evaluation support tools. And Sophie's reflected here, the M&E Help Desk sounds very interesting and is something we're currently exploring in the German context. Promising because it provides hands-on tailored support that is currently lacking within the field. That practitioners can contact the center for free is a distinct benefit, especially for initiatives with smaller or no evaluation budgets. So thank you very much, Sophie, for that input and reflection. Now, going to some of the other questions also, and I don't know if you want to say anything in response to that specifically, but I'd like to raise, let me see where this question is. Yes, you answered it in part now, Antoine. So one, it could be a reflection towards the question raised by Sophie. Also, I'd like to bring forward this question coming at us in terms of tailoring towards local context. So here specifically is from Ame Kenneth Seidu from Nigeria, I believe, looking at in this case, the Indeed toolkit, or also the work of the M&E Center of Excellence, be domesticated, tailored to harvesting impact of PCVE work of local practitioners in Nigeria. What would be your level of participation as a center if we mobilize and organize CSOs working on PCVE to participate in trainings on M&E in the PCVE field in Nigeria? Now, you mentioned that one area that you will be working on is training. We've also spoken about the Indeed trainings. We are creating a training support package, which will be available in 10 languages. And the Indeed trainings have been specifically created to enable tailoring them to local context. You can either take the entire training package, the PowerPoint, the support kit, the training manual, and apply them in full, or you can also look at individual modules that are relevant or individual content and then tailor that for your specific needs and context. But if you could, your thoughts on Sophie's input coming from the experience and what they're working to advance in Germany, and also what is possible from the Center of Excellence in terms of support for training in this field for practitioners.
I'll be very succinct because I'm looking at the time. So Sophie, great point. Thank you very much for sharing. This is why we wanted this free service. It's exactly for those who have no or little budget, because we know that is the reality of the field. So us being available 30 minutes. And again, I'm going to say it's a French 30 minutes. You know, it could be 31, it could be 45. It depends how interesting, how complex. But this is exactly the idea, is to make it more approachable for everyone. Hopefully we're not inundated and we can manage. We'll see. I mean, there's a lot of participants, but this is exactly the idea, is to be able to help from the get-go people with sometimes what you could think is a dumb question, but ends up being the crux of your entire projects. So be honest, I'm actually reach out to learn more because this is indeed important. And to some extent, our barrier would then be maybe linguistic for some of the smaller programs, but I think this is overcomable. And this sort of segues then to the question for Nigeria, Mr. Sidhu. And the whole point is, yes, we want to be adaptable to any context, whether it's Nigeria or anything else, because this is the whole idea of evaluation-based evidence-based evaluation, is we don't have one model we apply to people. It's the other way around. We want to get people to have the tools so they can build the models, whether it's the Indeed ones or others, and help them to tailor those to their context and help them ask the right questions, or maybe some things they haven't thought of. So it is really a bottom-up approach with the idea of then coming with some top-down from knowledge. But maybe if Eileen wants, she can also expand on this as well. But thank you very much for this comment and the question.
Yeah, thanks so much. Indeed, that is what we want to do. So we want to work with local M&E practitioners. So it is, I think, so a lot of the time when we talk about evaluation, we talk about external evaluation. That doesn't, we very strongly believe in the combination of having internal and external evaluators. So when you're working on a project, it's really important to have someone super familiar with the context, with the implementation, working on the evaluation. And then it's helpful to have someone who worked outside of the project. That can be someone obviously from the same country, but it can also be someone from the Center of Excellence who has worked, for instance, in different contexts and can bring experience to that. So the idea of the center is to connect a lot of different stakeholders. So that can be local M&E practitioners in Nigeria that we can help mentor them, provide trainings to them, or answer questions through the free help desk. So there are different levels of engagement through which we can support. And it is really to build a community of M&E practitioners who can work together and support each other where possible, and get the different type of support that's needed for each different assignment and evaluation exercise.
And thank you so much for that response and for that mentioning an M&E community of practitioners. So for everyone who's joining us, we're now coming to the very end of the webinar. And if it is all right, I would like to take a moment to share with you some of the upcoming opportunities brought forward from the Indeed project in the field. So I hope you can now see this clearly. These are some of the upcoming events and initiatives from Indeed. So as was mentioned, the Cascade trainings. We'll have Cascade trainings taking place over the coming weeks and months in countries across Europe. We also have the training support package, which will be available soon online, and that can be used for tailoring trainings for your local situations and contexts around the world, as well as the e-learning course, again, which will be available online for taking at your own pace. In addition to the Cascade trainings, we will be launching later this week, so this isn't even formally promoted yet, but the Indeed Policy Forum. And the Policy Forum will be taking place online on June 27th and 28th. And here we'll have colleagues from the Indeed project, which will look at how can the evidence-based evaluation tool, the repository, other materials that have been developed in the project, how can they support evidence-based policy making and this critical issue of the role of policy and policymakers in improving evidence-based practice, and this question that Antoine also brought up, that support for evaluation, that we're engaging with policymakers to show why evaluation is important to the field and why having policy level support for it can help contribute to improving evidence-based evaluation and evidence-based practice. This will be followed by an in-person policy recommendations workshop on the 12th of July in Riga, bringing together policymakers from across the European space and experts working in PCVE and de-radicalization. You'll find more information about that on the Indeed website and through the Indeed newsletter. We're also very excited to share with you that the second Indeed International Policy and Practitioners Forum on From Evidence to Practice Towards Improved Policy and Practice will be held in person in Warsaw, Poland from September 11th through the 13th. This will also include the final event of the Indeed project on September 13th. We're looking forward to being joined by expert evaluators, practitioners, policymakers, people working in the field from across Europe. The forum will also be done as a joint collaborative process. We're reaching out to other projects, we're reaching out to other institutions and agencies, including the ICCT M&E Center of Excellence, to do this together and to really work together on making this forum a relevant space to advance evidence-based evaluation, policy, and practice in the field. With that said, also to mention for the online policy forum on June 28th and in person in Warsaw on September 12th, we'll be having special sessions on the idea of a community of practice on evidence-based evaluation in the PCVE and de-radicalization field, where we'll be working together with the team at the United Nations and with other organizations in the field, such as the M&E Center of Excellence. We've also reached out to our colleagues in Preval and to other organizations, Hadaya as well, to look together at bringing forward this effort to create a community of practice and really seeing why would it help, what could it do, and to listen to practitioners. What do we want from a community of practice to make it useful for us? Again, as mentioned, Indeed is also working on the creation of the self-paced e-learning course. So if these topics are of interest to you and you want to go through an online version of the training that Antoine and Eileen mentioned, you can do that through the e-learning course, which will be available shortly. We will communicate both through the Indeed website, newsletter, and on social media channels when it is being launched, and people will be able to take that at their pace. Again, just to share, the Indeed Knowledge Series, bringing forward webinars, podcasts, video interviews, and learning notes. You'll find all of the webinars we've done uploaded shortly on the Indeed platform, and we'll be sharing these as well. Also, if you have the chance, we'd like to ask you to give your feedback on how the JALSA topic has been taken up within this webinar. We do this in every single Indeed event that we do, looking at how are we bringing forward the orientation and focus on the gender, ethical, legal, and societal aspects. So that was a lot of information to share. I hope it wasn't too much, but there are exciting developments and work being done in this field. But for today, I'd like to say thank you so much to everyone who has joined us. A special thank you, Eileen and Antoine, for sharing with us today. Congratulations to you and the team at the International Center for Counter-Terrorism, ICCT, on the launch of the new M&E Center of Excellence. We hope that today's webinar has been interesting and useful for everyone who has joined, and we hope to have you with us at future events. Thank you very much to everyone. Mulțumesc și cât să numai, and wishing you a wonderful day forward.